So I would like to thank the organizers to invite me to the annual meeting and to give a presentation on Swissmedic's view on international collaborations. Before I come to the present time, I would like to start with a historical view on international collaborations, and I would call it the cluster collaboration concept. In this type of collaboration, different agencies came together to exchange their views and perspective on specific scientific topics. In the context of medical product review, the clusters were specific to disease areas, and agencies discussed very concrete medical product applications within that disease area. The very first cluster was founded back in 2004 for hematology and oncology, and the two founding agencies were FDA and EMA. This very successful cluster existed ever since, and it has grown also to 4 additional agencies that have joined, which were Canada, Japan, Australia, and Switzerland. Meanwhile, reaching present times, there are additional 30 clusters that are taking place in parallel in all fields of disease areas, drug development plans, guidelines, or other scientific topics. Next to the cluster collaborations of the past that have transmitted to the present, there are 2 new concepts that have emerged that are worth mentioning here. The first concept is the parallel review concept. Here, different agencies work independently in parallel on a drug application. They share their views in joint meetings during the ongoing assessment of the drug. The aim is not to have the same outcome for the decision making, but have a clear view on the benefits, risks, and uncertainties of the application. Based on that same baseline of knowledge, each agency takes an independent decision and action. The second is the reliance concept. Here, different independent agencies decide amongst each other who will take the lead on the assessment for a given drug application. This particular leading agency will make the assessment, and the others rely or peer the assessment of the leading agency. Depending on the strategic setup of that collaboration, the others may follow the recommendation of the lead agency. And this is a true work sharing model approach. For the parallel review concept, Project Orbis is the prototype, and you heard about this a lot from my former speaker, Angelo. The strategic imperative of Orbis was that the data for the application are submitted at the same time to FDA and smaller agencies in order to reduce the submission gap so that more patients would have faster access to innovative cancer treatments. For the reliance concept, the EMA rapporteur-co-rapporteur approach is an example that comes to mind. Another example is the work-sharing model of the Access Consortium between 5 agencies that I will discuss in a bit. So now we turn to Swissmedic. Swissmedic is the Swiss Agency for Therapeutic Products. And Swissmedic participates in both of these international collaborations, Project Orbis and the Access Consortium. So why do we at Swissmedic collaborate here? We do that because it's the perfect match for Swissmedic into its strategic objectives. In total, we have 7 strategic objectives in the currently given time frame. And 2 of them in particular are related to international collaboration. The first strategic objective is relevant in the sense of international collaboration, is basically the acceleration of time-critical processes to meet the expectation of patients to have access to innovative therapies as a fast authority which perfectly fits into Project Orbis. The second strategic objective is what we at Swissmedic use, that we at Swissmedic use a work-sharing approach and rely of other authorities, which also fits very nicely to the Access Consortium approach. So let's turn to Project Orbis first. It started in 2020 at Swissmedic as a pilot, a one-year pilot. And in 2021, we had to decide whether or not Project Orbis is successful and if Project Orbis would be then implemented into the Swissmedic process. So what makes Orbis successful for Switzerland? Well, it's a very easy answer. Orbis is successful if more patients would have access to innovative cancer treatments in Switzerland. And there are two options how an assessment can be accelerated. Either the submission gap, so the submission date between the FDA and Swissmedic, can be shortened, or the drug assessment time can be shortened. If both elements are shortened, then this would lead to a faster receiving and approval of an application. As a consequence, a faster availability of innovative cancer drugs would be there for patients. And before I come to the results of Orbis in Switzerland, I would like to share the number of applications so far performed. So as of today, we have received and done 31 submissions, and the numbers are clearly rising between 2020 and 21. So we have completed 18 applications, 12 are in assessment, and we have accepted an additional one. And it's of interest that about 1/3 of the applications were in new active substances, while 2/3 were indication extensions. So when we talk about Project Orbis, there are different Orbis types available, and we have basically defined those. Angelo has explained it in his talk as well, but I would like to remind again on the differences of the different types. So the type A is a true parallel review where the submission gap is below 30 days. Conferences are scheduled between the Orbis partners and the FDA, and the scientific issues are discussed. And of course, there is no FDA approval at that time. Type B, called modified Orbis, here the submission gap is longer. It can be very variable. It can be 31 days, could be longer than that. And normally, there are also conferences scheduled between the Orbis partners and the FDA. The approval time is variable. Very often, FDA has not approved yet and takes action during or at a later stage. Type C is very different from the other type A and B. This is a report sharing only. So the assessment report of the FDA is shared with the Orbis partner. Here, the submission gap is way longer than 30 days. Normally, there are no conferences scheduled, and FDA has approved already this application. So these types are important to understand if we now come to the results for Switzerland on Project Orbis. We first look at the submission gap. So when we want to see if there was a change on the submission gap, we first of all have to set a baseline. And we calculated basically, and our colleagues from SILS set the benchmark here. We calculated the Swissmedic submission gap for a 5-year time period and compared that then to the submission gap of all Orbis applications we so far have received. And as you can see, there's a great reduction by over 70% in the submission gap in Switzerland when using Orbis as compared to the time before when we did not use Orbis. And Breaking it down to the different types of application, it can be seen that the greatest reduction in terms of submission gap is seen for Orbis A types. It is also present, but to a lesser degree, for type B. And there is virtually no benefit any longer and no reduction in submission gap when we look at Orbis type C. Coming now to the drug assessment times in Orbis. So we have in Switzerland for all different regulatory pathways, different timelines. Taking those together, we set them now as 100% and compare them to the completed Orbis projects assessments. And as you can see, we were in fact faster by 33% performing Orbis. And again, what you also have observed for the submission gap, the reduction of the assessment times is different for Orbis A, B, and C. The greatest reduction was seen in type A. The B was intermediate with minus 20%. And for type C, there was virtually no huge benefit in terms of reduction of assessment time. The largest benefit in Orbis type A is due to the fact that we do, during the assessment, directly information requests, so rolling questions towards the companies, which is not a normal Swissmedic procedure. And that led to a great reduction, the great reduction that we observed by almost 40% for type A applications. So I hope I could show you that we were able to reduce the submission gap with Orbis as well as the drug assessment time. And therefore, the project Orbis, this pilot, was successful for Swissmedic. And therefore, we have implemented Orbis completely to Swissmedic processes. So now shift gears and come to the Access Consortium. The strategic objective of Access is a work-sharing approach. There are 5 agencies at the Access Consortium, which are Australia, Canada, Singapore, Switzerland, and very recently, UK joined us due to Brexit. For the different submitted data modules, one agency is in the lead and does the assessment for the other agencies. The other agencies peer the assessment of the lead agency, and the questions to the company are jointly developed. After Access received the answers from the applicant, the lead agency formulates then the benefit risk conclusion, and in most cases, the other agency comes to the same benefit risk conclusion as the lead agency. It should be noted, however, that it's important that each agency remains fully independent in their decision-making. Within Access, there are different work streams combined. We have the work stream, for example, for new active substances. That also includes indication extension. There's the generic medicine work stream, the biosimilar work stream, as well as a COVID work stream. There are also others, but I would like to concentrate on the first one, new active substances, the new active substances working group. So in total, we have done at Swissmedic 17 submissions so far. We've completed 7, 8 are in assessment, and 2 are lined up in pipeline. It is important to stress that the majority of those applications were in for new active substances. Now, looking at the completed ones, we see a significant increase from 2020 to 2021. It's also interesting to see that only one application was in hematology and oncology, while the others were scattered around other disease areas. So let's come to the assessment time. And first of all, Swissmedic has a regular assessment time for applications. but so do all access partners have their own access time. So the access NAS working stream, when coming together, have basically formulated an agreed access assessment timeline. And this I have put as 100%. And now the 7 applications, they stayed in the agreed assessment time as depicted here. Because you could envision that potentially due to the collaborations, the questions, the telephone conferences, there might be delays, but this was in fact not the case. So in summary, one can conclude for Swissmedic, these were very successful international collaborations, and they will be continued in the future. Allow me one last word, looking to the future. So I have covered the past and the present, but how does the future look like? And my personal belief is that there will be a coexistence between all 3 mentioned collaborations. So we will have the cluster collaboration concept, the parallel review concept, the reliance concept. But what we might see in the future are additional hybrid concepts between the parallel concept and the reliance concept. Certain agencies are legally obliged to always perform an independent review. They will never qualify for a reliance concept, and the FDA is an example. But the parallel concept, this would qualify for these kind of agencies. So there will be a lead agencies, and other agencies will follow the lead agency by reliance. The degree of these hybrid concepts that we might see in the future depend on 3 things. Firstly, the country-specific legal situation. Secondly, the strategic focus of the agency, if there's interest in international collaborations. And lastly, the experiences of the agency with these types of collaborations. And with that, I thank you for listening, and I'm happy to take any questions in the breakout, and let's have a good discussion there. Thank you very much.